All right, let's dive right in today.
Sounds good to me.
We're tackling something that's, well, pretty fundamental. Your oral health.
Yeah, I mean, we all know it's important. Brush your teeth, all that.
Right. But we're going deeper than just the basics. We've got some fascinating stuff to unpack, including this really interesting conversation with Dr. Staci Whitman. She's a functional dentist, and she was on the Huberman Lab Podcast.
Oh, I heard that one.
Yeah, it's a goldmine of information. What really struck me is just how connected our mouths are to the rest of our health. I mean, we're talking about links to the brain, heart, hormones, even things like fertility.
Seriously.
Fertility.
Yep. It's all connected. So today, our mission, if you will, is to pull out those insights from Dr. Whitman that you can actually use, starting today. Stuff that can make a real difference in your everyday life.
I'm all for practical tips. Let's get into it.
So one of the first things that really jumped out at me was how many things we do for like a bright smile and fresh breath might actually be, well, not doing us any favors. Yeah, like that whole idea that stronger and mintier means cleaner. Dr. Whitman really challenges that, and honestly, it's kind of eye-opening.
It is. So she talks about this idea that, we tend to think of our mouths as kind of separate from the rest of our bodies. But really, it's the entry point to our entire digestive system.
The gateway to the gut, right?
Exactly. And what happens in our mouths, it has ripple effects throughout our system. So let's start with some of those common practices that might need a little rethink.
Okay, so like you said, that feeling of intense mint and all the bubbles.
Oh, yeah, the bubbles.
It's almost like a cultural thing, right? But Dr. Whitman says that's not necessarily the sign of a truly healthy mouth. It's more about balance. And a big part of that is the oral microbiome, all those beneficial bacteria that are crucial for keeping things in check. But she points out that a lot of our go-to products, with the astringents, alcohol, and those really strong essential oils, they can actually disrupt that balance. It's like using a weed whacker in your garden when all you need to do is pull up a couple of weeds by hand.
Ooh, I like that analogy.
Yeah, you end up doing more harm than good.
So that minty blast might be throwing things off kilter.
Potentially, yeah. And she really stresses that we need to shift our focus from just those products to a more holistic approach. It's about diet, lifestyle, creating the right environment in our mouths.
It sounds familiar,
right?
Like all the stuff we've been learning about gut health.
Totally. And speaking of ingredients, Dr. Whitman even suggests we should be reading those labels on our toothpaste and mouthwash with the same scrutiny as we do our food labels. Makes you think, right?
It does. I'm definitely going to be paying more attention to that from now on.
So let's take SLS, for example. Sodium lauryl sulfate. It's what gives toothpaste that foamy quality.
Okay, yeah, the lather.
But she points out that SLS can actually irritate the delicate tissues in our mouths and may even be a trigger for canker sores.
Ugh, canker sores. Those are the worst.
Yeah, and it's not just regular SLS. Even the coconut-derived versions, which are marketed as being more natural, can be problematic for some people.
So if you get canker sores often, that's definitely something to look at on the ingredient list.
Definitely. And then there's the whole world of essential oils, which are generally seen as healthy.
Right. Naturally good.
Exactly. But Dr. Whitman cautions that a lot of them, especially in oral care products, can be really potent. And that potency, while good for some things, can also harm the beneficial bacteria in our mouths.
There's that balance thing again.
Yeah, it's not about demonizing essential oils. It's more about understanding that they're powerful and using them wisely.
Makes sense. Now, another thing that stuck with me was Dr. Whitman's take on the whole point of brushing.
Yeah, she really reframes it in a way that makes a lot of sense.
Totally. So it's not about creating mountains of foam or that intense burning sensation. It's about something much more fundamental.
It's about physically disrupting that biofilm, that sticky plaque on our teeth.
Okay, the plaque.
Which essentially is a community of bacteria. And the whole point of brushing is to break up that community and prevent it from taking over.
So all the fancy extras in toothpaste, they're almost secondary.
Exactly. And if our oral microbiome is already out of whack, those extras might actually be doing more harm than good.
So a gentler approach, focused on physically removing the plaque, could be more effective.
Especially if you're already struggling with things like canker sores or sensitivity.
That's really helpful. Now, Dr. Whitman also talked about this constant back and forth happening in our mouths, this process of demineralization and remineralization. Can you break that down for us?
Sure. So our teeth are constantly going through these two processes. Demineralization is basically when minerals, mainly calcium and phosphorus, are lost from our teeth.
Okay, so they're being weakened.
In a way, yes. And this happens every time we eat or drink anything acidic.
Because the pH in our mouths drops.
Exactly. Yeah. And as we digest food, those enzymes that are released, they create a more acidic environment. It's like a natural part of the digestive process.
So every meal, every snack, we're essentially weakening our teeth a tiny bit.
You could say that. But luckily, we have this incredible natural repair system, remineralization.
Our bodies are so smart.
Right. And this is where saliva comes in.
Saliva, our best friend.
Dr. Whitman calls it the golden elixir, and she's not kidding. Saliva contains calcium and phosphorus, the same minerals that are lost during demineralization. But it also has immune cells, enzymes, all sorts of good stuff that help rebuild and strengthen our teeth.
Wow, so it's like a built-in defense and repair mechanism.
Exactly. And she talks about this thing called the Stefan curve, which is basically a visual representation of how the pH levels in our mouths fluctuate throughout the day. It drops when we eat and then gradually goes back up as our saliva does its work.
Okay, so there's this constant up and down.
Right. The problem is, with our modern eating habits, we tend to snack and sip on things constantly, and this can keep our mouths in that acidic, demineralized state for way longer than they should be.
So we're not giving our saliva enough time to do its job.
Exactly. It's like constantly interrupting a construction crew trying to repair a road.
Oh, I see. So giving our mouths a break between meals and snacks is really important.
It is. It allows for that full remineralization process to happen.
That makes a lot of sense. Now, what about those small cavities, or as dentists call them, incipient lesions?
Those are the early stages of decay, and luckily, they can actually remineralize.
Really? Even cavities can heal themselves.
Well, not quite heal themselves, but with the help of saliva and the right conditions, those minerals can be redeposited and strengthen that weakened enamel.
That's good news.
It is. This is where working with a dentist who understands these processes, like a functional or biological dentist, can be really helpful. They can assess the depth of those lesions and guide you on strategies to support remineralization.
Okay, so early detection is key.
Absolutely. Now let's talk about fluoride. It's a topic that always comes up when we're discussing oral health.
Yeah, it's in most toothpastes, and we've been told it's good for us since we were kids. But Dr. Whitman also mentioned some potential downsides.
Right. It's a bit of a complex issue. So to understand how fluoride works, we need to understand what our teeth are made of.
Okay, tell me more.
So the main component of tooth enamel is hydroxyapatite. It's basically a compound of calcium and phosphorus. And our saliva also contains these minerals.
Makes sense.
Now, fluoride comes in and changes the structure of that hydroxyapatite, turning it into fluorapatite. And this fluorapatite is generally considered more resistant to acid attacks. It's like adding a layer of armor to our teeth.
Okay, so that's the benefit.
Yeah, and that's why it was added to toothpaste back in the 1960s. It's been a cornerstone of dental care for a long time. But there are some things to consider.
Like what?
Well, one of the main concerns is that fluoride's antimicrobial action isn't very specific. It can kill off the bad bacteria, but it can also affect the good bacteria that make up a healthy oral microbiome.
Right, like those harsh mouthwashes we talked about.
Exactly. It's like using a broad-spectrum antibiotic when you really only need a targeted one.
So it's not without its risks.
No. And another thing is that while fluoride does raise the pH level at which enamel and dentin start to demineralize, it's not a substitute for a good diet.
Meaning?
Meaning that if you're constantly eating and drinking things that are acidic, fluoride alone won't save your teeth.
So it's a helpful tool, but it's not a magic bullet.
Exactly. It's like wearing a raincoat in a hurricane. It'll help, but it won't solve the whole problem.
That's a good way to put it. Now, Dr. Whitman also talked about the importance of timing when it comes to remineralization. Can you explain what she meant?
Sure. So as we talked about, our mouths become more acidic after we eat or drink anything other than plain water. And it takes about 20 to 30 minutes for our saliva to buffer that acidity and bring the pH back up.
Okay.
So the best time for remineralization to happen is when our mouths are in that neutral pH zone.
Meaning when we're not eating or drinking.
Exactly. That's when our saliva can really do its work and redeposit those minerals back onto our teeth.
So those breaks between meals and snacks are crucial.
They are. And this is where things like intermittent fasting or time-restricted eating can actually be beneficial for our oral health. By reducing the frequency of those acid attacks, we're giving our saliva more time to repair and rebuild.
That's fascinating. So those eating patterns that we might adopt for other health reasons can have a positive impact on our teeth as well.
Yeah, it's all connected. Now let's talk about diet. This is a big one.
I think we all know that what we eat affects our overall health, but how does it specifically impact our oral health on a daily basis?
Well, as we've touched on, the main culprit behind cavities isn't actually sugar itself. It's the acid that's produced by bacteria when they break down sugars and other fermentable carbohydrates in our mouths.
So it's the bacteria's byproduct that's the problem.
Exactly. And it's not just the obvious sugary culprits like candy and soda. Things like crackers, chips, white bread, they all break down into sugars that feed those bacteria.
Okay, so those seemingly harmless snacks can be just as bad.
They can be, especially if they're sticky because they hang around in our teeth longer, giving those bacteria more time to produce acid.
So it's not just what we eat, but also how long it stays in contact with our teeth.
Precisely. Dr. Whitman gave this great example of those little goldfish crackers. You know how they get stuck in all the nooks and crannies of your teeth?
Oh yeah, I can picture it.
It's like an all-you-can-eat buffet for bacteria.
Not a good image. So what should we be eating for a healthier mouth?
Dr. Whitman is a big advocate for what she calls a clean diet. It's basically a diet that's rich in whole, unprocessed foods.
Things like fruits and vegetables.
Yes, lots of colorful fruits and veggies. They're full of prebiotic fiber, which helps nourish the good bacteria in our mouths.
So just like our gut, our mouth needs the right kind of fuel.
Exactly. And a good rule of thumb is to prioritize foods that come from farms over foods that come from factories.
Okay, that's easy to remember.
She also suggests limiting fruit intake, especially those that are high in sugar, and focusing on things like high-quality protein, nuts, seeds, olives, pickles, and fermented foods.
So a balanced and varied diet is key.
It is. And here's a bonus. She says a healthy diet can actually contribute to naturally whiter teeth.
Really? How so?
It has to do with how light reflects off the enamel. When our teeth are healthy and properly mineralized, they tend to reflect light differently, making them appear whiter.
Okay, so that's another great reason to eat well. Now let's talk about aging. How does our oral health change as we get older?
It's natural for our teeth to change over time. They might darken a bit, which can be due to things like decreased saliva production, a common issue as we age.
Dry mouth, right?
Yes, and dry mouth means less of that natural cleaning and remineralizing action from our saliva.
So it makes our teeth more vulnerable.
Exactly. And increased mouth breathing, which can also happen more as we age, can also dry out our mouths. Of course, years of exposure to things like coffee and tea can also stain our teeth over time. And for some people, especially older generations, there might be the factor of tetracycline exposure.
Tetracycline.
It's an antibiotic that was commonly used in the past, but it's known to cause tooth discoloration.
Ah, I see. So those changes in our teeth as we age, they're not necessarily from neglecting our oral hygiene.
Right, it's often a combination of factors. The important thing is to be aware of these changes and adjust our oral care routine accordingly.
Makes sense. Now, what about antibiotics? We've talked about how they can disrupt the gut microbiome, but what about their impact on our mouths?
It's similar, actually. Antibiotics can disrupt the delicate balance of bacteria in our mouths, which can sometimes lead to issues like stained teeth or inflamed gums.
So they can have a temporary negative effect.
Yes, but Dr. Whitman says that if antibiotic use is necessary, it's a good idea to think about repopulating those good bacteria afterwards.
Like with probiotics.
Exactly. There are even oral-specific probiotics that can help restore the balance in our mouths. And incorporating fermented foods into our diet can also be helpful.
Okay, good to know. Now, mouthwash. A lot of people use it daily, but Dr. Whitman seemed a bit cautious about it.
She is. Especially those strong, over-the-counter mouthwashes that contain alcohol and astringents.
Why is that?
Well, those ingredients can damage the beneficial bacteria that live on our tongues, specifically the ones that help produce nitric oxide.
Nitric oxide.
Yeah, it's a really important molecule for our cardiovascular health, blood flow, and immune function.
So using those harsh mouthwashes regularly could actually be bad for our hearts.
Potentially, yes. And Dr. Whitman also points out that chronic bad breath, halitosis, isn't always just a surface-level issue.
Yes.
It could be a sign of something else going on, like gum disease or an infection. So constantly masking bad breath with mouthwash might be covering up a bigger problem.
So it's important to address the root cause, not just the symptom.
Exactly. And she also advises being cautious with the overuse of strong essential oils and mints, as they can also disrupt the oral microbiome.
Okay, so less is more, especially when it comes to those potent ingredients. Now, we've talked a lot about saliva, but let's really dive into why it's so crucial for our oral health.
Saliva is truly amazing. It's not just water, it contains all sorts of things. Bacteria, viruses, fungi, hormones, digestive enzymes, immune cells, minerals, you name it.
Let's take a whole ecosystem in there.
It is. And all those components work together to help us chew, swallow, and protect our teeth.
So how do we keep our saliva healthy?
The most important thing is hydration. Staying well hydrated throughout the day is key.
Just plain water.
Yes, but Dr. Whitman also suggests adding a pinch of salt or some electrolytes to your water to improve absorption.
Oh, that's a good tip.
Another crucial factor is nasal breathing. Mouth breathing tends to dry out our mouths, which isn't good for saliva production.
Right, we talked about that earlier.
And a mineral-rich diet is also important. Getting enough magnesium, vitamin D3, and K2 can support healthy saliva production.
So it's a combination of those three things: hydration, nasal breathing, and a good diet.
Exactly. And Dr. Whitman also mentioned that salivary analysis and oral microbiome testing are becoming more and more common.
What are those tests for?
They can give us a lot of information about our overall health. The oral microbiome, believe it or not, has been linked to a wide range of conditions, including Alzheimer's, heart disease, autoimmune diseases, even cancer.
Wow, that's incredible.
It is. There are specific bacteria like Porphyromonas gingivalis and Fusobacterium nucleatum that have been implicated in these connections.
So our mouths can actually provide clues about our overall health.
Exactly. And these tests can help identify those clues. Now let's circle back to nasal breathing. Dr. Whitman seemed pretty passionate about it.
She did. Why is it so important, especially for our oral health?
Well, humans are designed to breathe through our noses. But it's estimated that up to 50% of people, and probably even more, habitually breathe through their mouths.
Really? That many?
Yeah, and one of the theories is that it's related to our modern diets. We chew much less than our ancestors did, which can lead to underdeveloped jaws and nasal passages.
So our soft, processed food is actually changing the shape of our faces.
In a way, yes. And this can have a big impact on how we breathe.
And if we're breathing through our mouths, that's drying them out, right?
Exactly. And a dry mouth is more prone to cavities, gum disease, all sorts of problems.
So nasal breathing is crucial.
It is. Dr. Whitman also mentioned that methamphetamine users often have severe dental issues, and it's not because of the drug itself, but because of the chronic mouth breathing it causes.
Wow, that's really striking.
It is. And she says that if you're a mouth breather, it's important to figure out why.
Okay, so how do we switch to nasal breathing, especially during sleep?
It depends on the cause. For kids, it might involve something called myofunctional therapy, which is basically exercises to retrain the muscles of the mouth and face.
Interesting.
And for adults, it might be more complex, involving things like palatal expanders to widen the nasal passages. But even simple things like mouth taping at night can be helpful.
Mouth taping?
Yeah, it sounds weird, but it can be really effective. But you have to do it safely, of course. Dr. Whitman recommends starting slowly and gradually increasing the time.
Okay, that makes sense. Now, what about chewing gum? Is it good or bad for our teeth?
It can be good, actually. Specifically, xylitol gum.
Xylitol.
Yeah, it's a natural sugar alcohol that doesn't feed the bad bacteria in our mouths. In fact, it can actually inhibit their growth.
Oh, that's interesting.
So chewing xylitol gum after meals or snacks when you can't brush right away can be a really helpful way to protect your teeth.
Good to know. Now, let's get back to those systemic links between our oral health and our overall health.
This is where things get really fascinating. There's growing evidence that the bacteria in our mouths can travel to other parts of our bodies and potentially contribute to a whole range of diseases.
So it's not just about our mouths, it's about our entire well-being.
Exactly. For example, gum disease has been linked to an increased risk of heart attack and stroke.
Really? That's serious.
It is. And it's not just heart health. Studies have shown that women with gum disease may take longer to conceive, and treating gum disease in men with fertility issues can improve their chances of conception.
Wow, that's amazing.
Right. It shows just how interconnected everything is. And then there's the connection to Alzheimer's disease. There's a specific bacterium, P. gingivalis, that's been found in the brains of people with Alzheimer's.
So could gum disease actually contribute to Alzheimer's?
It's a possibility, and more research is being done to understand the link.
That's fascinating.
And another bacterium, F. nucleatum, has been linked to an increased risk of certain cancers, like pancreatic, breast, and colorectal cancer.
Okay, this is really eye-opening.
It is. And Dr. Whitman talked about oral microbiome testing as a way to identify these potentially harmful bacteria.
So if we're concerned about these risks, we can get tested.
Yes, and there are different types of tests available. Some look at specific biomarkers, while others provide a more comprehensive analysis of the bacteria in your mouth.
So it's worth talking to our dentists about.
Absolutely.
Yeah.
Now, Dr. Whitman also spent a lot of time talking about fluoride in our drinking water.
Yeah, that's a pretty controversial topic.
It is. She actually shared her own personal journey on this issue. She used to be a proponent of water fluoridation, but she's since changed her mind after reviewing the research on potential risks.
What kind of risks are we talking about?
Well, there are concerns about endocrine disruption, neurotoxicity, and skeletal fluorosis. Basically, potential harm to our hormones, brains, and bones from long-term fluoride ingestion.
So it's not just about teeth anymore.
Right. And there's this ongoing federal trial looking into the long-term effects of fluoride, and a recent report from the National Toxicology Program found a strong link between higher fluoride intake and lower IQ scores in children.
That's concerning.
It is. And there are also ethical concerns about mass medication without consent.
Meaning that we don't really have a choice about whether or not we consume fluoride in our water.
Exactly. And a lot of countries don't fluoridate their water, and they still have low rates of tooth decay.
So there are other ways to prevent cavities.
Yes, like good oral hygiene, a healthy diet, and access to fluoride toothpaste.
So what's Dr. Whitman's overall stance on water fluoridation?
She believes it should be a personal choice. She says we need to weigh the potential benefits, which some studies suggest might be smaller than previously thought, against the potential risks.
So it's a decision we should make for ourselves based on the information available.
Exactly. Now, she also mentioned something called hypoplastic enamel, which is a growing concern in children.
What is hypoplastic enamel?
It's basically when the enamel on teeth doesn't develop properly. It can be caused by mineral deficiencies, vitamin D deficiency, exposure to toxins, high fevers, certain viral infections.
So the enamel is weaker than it should be.
Yes, and it can make teeth more susceptible to decay. Dr. Whitman says she's seeing more and more cases of this in her practice.
That's worrying.
It is, and it often leads to kids needing extensive dental work, which can be traumatic. She advocates for a more conservative approach, focusing on remineralization therapies to strengthen the enamel whenever possible.
So early intervention is key.
Absolutely. Now let's talk about hormones and oral health, specifically in women.
Okay, what's the connection there?
Well, throughout a woman's life, there are various hormonal fluctuations that can affect her oral health.
Like during puberty?
Yes, puberty, pregnancy, menopause, all these stages involve hormonal shifts that can impact the gums and teeth.
In what way?
Well, during puberty, for example, girls might experience more gum inflammation. And during pregnancy, many women get pregnancy gingivitis. And the hormone relaxin can actually loosen ligaments, potentially causing teeth to shift.
So pregnancy can really affect your mouth.
It can. And then during menopause, the decline in estrogen and progesterone can also lead to oral health issues like dry mouth, burning mouth syndrome, and even changes in taste.
So it's important for women to be aware of these hormonal changes and how they might impact their oral health.
Exactly, and to talk to their dentists about any concerns they have. Now, Dr. Whitman also talked about how our mouths can sometimes reflect nutritional deficiencies.
Like how?
Well, for example, cracks at the corners of the lips can be a sign of zinc deficiency, and a burning sensation in the mouth or a geographic tongue could indicate a B vitamin or iron deficiency.
So if we notice those things, it might be worth checking our nutrient levels.
It could be. Now, what about lip products? Do they have any impact on our oral health? It's something to be mindful of. A lot of lip balms and lipsticks contain petroleum-based products and other ingredients that we might not want to be ingesting on a regular basis.
Right, because some of it inevitably ends up in our mouths.
Exactly. So it's worth reading labels and choosing products that are made with natural and safe ingredients.
Okay, good advice. Now, for people with braces or retainers, are there any special considerations?
The main thing is just being extra diligent with oral hygiene. Braces and retainers create a lot of little spaces where food and bacteria can get trapped.
So it's harder to keep them clean?
It can be. So it's really important to brush and floss thoroughly and maybe even use specialized tools designed for orthodontic appliances.
Okay, good to know. Now, what about dental sealants? Are they a good idea?
They can be, especially for kids. Sealants basically act as a barrier, protecting the chewing surfaces of teeth from decay.
So they're like a shield for our teeth.
You could say that. They're particularly effective for those deep grooves and molars where food can easily get stuck.
So it's worth considering for kids who are prone to cavities.
Yes. And Dr. Whitman also talked about the importance of proper application, making sure no bacteria are trapped underneath, and using biocompatible materials.
So it's something to discuss with our dentists.
Absolutely. And for people with dentures, it's also important to maintain good hygiene to prevent infections and irritation.
Okay, that makes sense. Now, lastly, Dr. Whitman talked about finding a dentist who's a good fit for you.
Yes, she stressed the importance of feeling comfortable and heard by your dentist and recognizing that dental anxiety is a real thing for many people.
Yeah, I can relate to that.
She encourages open communication and finding a dentist who you trust and who makes you feel at ease.
So it's worth taking the time to find the right person.
Absolutely. Now, before we wrap up, let's summarize some of those key takeaways for improving our oral health.
Okay, let's do a quick recap.
So, first and foremost, be a nose breather whenever possible. Eat a clean diet, focusing on whole, unprocessed foods. Brush at least once a day, ideally at night. Floss daily. Consider tongue scraping and oil pulling a few times a week. Use a soft toothbrush and gentle brushing technique. Be mindful of mouthwashes with alcohol and strong essential oils. Stay informed about the fluoride debate and consider hydroxyapatite toothpaste. Hydrate well and maintain electrolyte balance. Prioritize good sleep, make sure you're getting enough minerals and vitamins, and talk to your dentist about oral microbiome testing if you're interested.
That's a great list. It really shows that there's so much we can do to take control of our oral health. And it's not just about aesthetics, it's about our overall well-being.
Exactly. It's about recognizing that our mouths are connected to every other part of our bodies.
And that the choices we make every day, from what we eat to how we breathe, have a ripple effect throughout our entire system. You've heard the science, you have the practical tips, now it's time to put it all into action.
And as you start implementing these changes, here's a final thought-provoking question for you. What other seemingly small or localized areas of your body might be holding equally powerful keys to your overall health?
That's something to ponder.
Yeah.
Maybe it's time we all start paying a little more attention to those often overlooked parts of ourselves.
That's a great takeaway.
Thanks for joining us on this deep dive into oral health. Until next time, be well.
Be well.